All right, guys, welcome back. We're going to go straight into our first scenario. So the first scenario is the Incredible Hulk. We have Albert Nagu, who will be the patient, Sarish Salim, who will be the orthopedic surgeon, and Hashim Al-Musawi as the nurse/helper to help Sarish if she's struggling. So the scenario is as follows. Mr. Smith has minimal hip arthritis. He is demanding a hip replacement. You don't think he would benefit for various physical, psychological, and social reasons. Mr. Smith is getting angry and claims that you are doing it to save money. How do you reach a conclusion? You'll have 5 to 10 minutes to resolve the scenario, and then there'll be 5 minutes summary and questions from the main panel. So, over to the candidates and the actor.
Hi, can you see me? Hi, my name is Sarah Salim. I'm one of the orthopedic surgeons. Are you Mr. Smith?
Hi, yes, I'm Mr. Smith. As the name suggests, but I'm actually Chinese, but I was adopted. So that's why I'm Mr. Smith.
How can we help you today?
I've got this pain in my right groin, and it's been there for a while now. So it's just coming to try and get an opinion on my right hip, really.
Okay, and how long has it been there for?
So I noticed it about 18 months ago. Initially, because of the whole COVID thing, I was a bit apprehensive coming to hospital, but it's not always there, but it comes and goes quite a lot.
And how does it affect your life?
So I'm very keen. Yeah, I'm a very keen walker. I like to walk at least about 5 to 10 miles every 2 to 3 days. I go for a walk with my wife.
Well done.
And I find whenever at the end of the day, after a long walk, particularly when I hit the roughly about 5 miles sometimes, I get this groin pain. It's really painful in my right hip.
Okay, and how have you been managing it so far?
So I'm not. I don't believe in taking any painkillers, so I just get on with it usually, and then get some sleep, and then when I wake up in the morning, it's a bit stiff, but it gets better during the day. So I've just carried on, really.
Okay, and have you seen anybody about this?
What, professionally, you mean?
Yeah.
No, I haven't. I haven't.
No.
Yeah, but I spoke to some of my friends, my neighbor. They've had hip replacements, and they said that they're absolutely brilliant. They usually walk very short distances, and then one of them had a hip replacement, and he's walking without any sticks.
Oh wow, that's impressive. Is that something you wanted to discuss today with us?
Yeah, that's basically something I want to have done if I can, really, because I'm hoping that will help with my pain.
Yeah, so certainly hip replacement are one of the options we have for hip arthritis. Do you know more about hip replacement? What did your friends tell you?
Well, I'm only 60. I heard Andy Murray, he had a hip replacement and he went back to playing tennis. That's what I want to do, really. I mean, I don't play tennis, but I play basketball regularly as well in the local league. So I was wondering if I could have a hip replacement and then go back. I mean, I'm not professional, but I still play in a local league, still play competitively.
And you're aware that you've got hip arthritis, and that's the problem.
Yeah, I think I had an X-ray which showed that I've got. I had the report here somewhere. It says some minimal degenerative changes on my X-ray reports. So I think that's why I've been referred to yourself. Is that right?
Yeah, that's exactly why you're referred here, so that we can have a conversation about your hip. So, what do you know about arthritis in general?
Well, I suppose if you get old enough, your joints tend to hurt and wear out, and that's why you get arthritis. And I think I'm heading that way. Or well, it says that I've already got degenerative changes, so I'm assuming I've already got arthritis in my hips, and I don't really want that to get worse.
Okay, and have you heard of any other treatments or ways to deal with arthritis?
Not particularly. If you have arthritis, I think, isn't it? There's no other way of treating it apart from a hip replacement.
Just 1 second, I've lost my. Yeah. Okay. So I know I think my colleague here would agree with me that arthritis affects a huge number of population, and we do help people with arthritis in many ways. One of them is surgery, but we have other options. Would you be interested to know about the other options?
Well, anything that works, but I know the other options don't seem to be very useful. They all ended up having hip replacements anyway. So why can't I get that done like sooner rather than later if it's an option?
Yeah, I hear you when you say that. Why not do it earlier? When you're gonna anyways end up with a hip replacement. But the other options that we have are physiotherapy. Have you heard about physiotherapy, or have you considered physiotherapy before?
Well, I do also the exercises. I've not formally seen a physiotherapist, but yeah, I do all the exercises. Like I still play
Yeah.
sports, and I do my stretching, before the games.
I think at this moment, where you are in your arthritis, it would seem beneficial and good for you if we start you on some formal physiotherapy, starting with a physiotherapy assessment. What do you think?
Well, can I just ask you a question? You mentioned at this stage of arthritis. What do you mean by that? Because it says I've got arthritis in my hip joint, and it's really affecting me, and I'm not sure if physio would do me any good.
Okay. Have you um spoken to anybody about physiotherapy, or do you know anything about physiotherapy?
Like I said, I haven't spoken to anybody about
No, you
physiotherapy, but
haven't.
I do all the exercises.
Yeah. I think at this moment we'd benefit from starting with some formal physiotherapy. But I hear you. I think where you're leaning towards is asking me the question about why can't I get a hip replacement, or should I get a hip replacement? Am I right?
Yes, yeah. That's the whole reason why
Yeah,
I'm here.
that's why we that's
trying
why
to get a
we're
hip
here.
replacement.
Yeah. Um, I think at the I've considered your case. I've gone through your images, and it looks like we're not at that stage yet where we benefit from a hip replacement. I think we ought to try some non-surgical measures first. And you want to ask me why, so I'm going to let you ask why we would.
Yeah. Why exactly? Why do you
Why?
think I'm not
So
fit at the moment?
that's a good question. That's a really good question. And so with anything in life, there are benefits and then there are risks. And with surgery, especially orthopedic surgery, these are big surgeries and they have a lot of risk factors. And we always have to weigh the benefits with the risks when we're considering surgery. Do you want me to go through?
I
Yeah.
understand the risk. I mean, I'm a fit 60-year-old. I mean, I'm not Andy Murray, but he had a hip replacement. He had a hip replacement so young. I mean, he's had arthritis in his hips, and he seems to be going back to playing tennis. So I'm just trying to get back because this pain is really limiting me, and I really would like to have a hip replacement, but I can't see why you're not giving me that option.
I think that option is on the table, but only when we've exhausted the other options. I think what I'm trying to get here at is there are some risks with procedures, with operative procedures, and you said that you'd know. Do you wanna tell me what you know about these risks so we can have like a better discussion about this?
I mean, yeah. So risk obviously with if they put you to sleep, there's always a chance that you never wake up. But if I had to live with this pain, I'm willing to take that risk. That's the biggest risk, isn't it?
Yeah, that's one of the risks. There's the risk of bleeding, and there's the risk of infection, the risk of clot, and being in a worse position than you already are. And the way I'd suggest, the thing that I think is best for you at the moment is to try different things, to try non-surgical options, and then see where we are. I mean, you can always come see us again, and we can always consider this because
I mean,
it is an
I come
option.
back and it's the same thing. Like, well, as in, why delay it if it's something that's going to happen? Is it because you guys are trying to save money? Is it waiting list? I mean, am I not important enough?
You're very important. You're very important to us, and I don't think it's about money, but it's about safety and seeing what is best at that very moment. May I ask you what you do for a living?
Yeah, I'm a builder, and it's really affecting me as well. I'm a self-employed builder.
Mm-hmm. Okay. I can give you an analogy, and when someone asks you to build something, like a room, and they haven't prepped you, given you the right materials, or prepped the area well for you to do your job, it becomes difficult for you. And I think same goes with surgery. I think one needs to be prepared for it mentally and physically, and that involves a lot of exercise and physiotherapy. And many people have gained benefit from just physiotherapy and have avoided surgery altogether. What do you think about what I just said? Does that make sense?
But how does physiotherapy help the hip? I don't understand. I mean, if you've arthritis, you have arthritis in the hip, isn't it? So it's grinding away. It's just so painful.
What it will do is it'll strengthen the muscles around the joint, and it will support the joint better. So it is known to help and prevent further disease. You seem unhappy. How can I stop that? You seem angrier by the second. So tell me, what's going on?
Yeah, just this pain in my hip, and I'm not confident that physiotherapy will do me any good. Essentially, it's just a delaying tactic, isn't it? So until my hip wears out. So it's just slightly frustrated from that point. I want something doing about my hip, because the issue is I work as a builder. My pain gets worse. I can't do my walks that I normally do, and playing in the basketball every week in the local league, it's really taking its toll as well. I just want to be like I was 5 years ago.
Right. Can I stop you there? Time out.
Sorry, Salim.
No, that's fine.
Well done, Sarish and Albert Smith. Sorry, Mr. Smith.
It's talking so badly.
We're laughing, Sarish. Why don't you tell us how you feel? What did you? How were you doing that?
Just 1 second. I've lost my camera again. 1 second. Yes, I'm back. It was better than I thought it was gonna be, because he didn't get aggressive. I thought he was gonna get aggressive, but he didn't. I couldn't communicate with the nurse because of the question.
Why did you think?
The question, the scenario, and I've been in a situation where someone's been aggressive, so I was just preparing for the worst, actually.
Okay, all right. So this is a scenario that you've experienced before, have you?
Yeah, I have. I have experienced angry patients before.
Okay, and so I'm sorry that you had to go through that. And and just for the rest of the webinar, so that they are aware, you are an foundation year doctor. Is that correct?
Yeah, I'm an F2. Yeah.
F2, and you've already in your fledgling career been exposed to conflict with patients. Yeah.
Yep. Yeah. In A&E, yes.
And were you given any kind of training about dealing with conflict patients prior to this?
No.
Okay. And after your situation in real life, did you have any training on how to deal with the conflicts?
No, just constructive feedback, I guess. Yeah, good constructive feedback.
From whom? The patient,
one of the consultants and seniors registrars, to escalate appropriately.
Okay.
Yeah, right. That was the feedback.
So I'm going to hold on to that. Thank you very much, Sarish. What about you, Albert? How were you feeling during that?
It's quite a common scenario, isn't it? Sometimes when you refer patients off to physiotherapy, and that's not, and so your discussion didn't meet their expectation, and they're usually quite upset about it. And
you are more of a senior a higher specialist trainee, and how is this becoming more of a common scenario for?
Yes, I think so.
Yeah, and Hashim, you were there as the nurse chaperone.
Yeah, sorry, I wanted to intervene, but Albert was so calm and he didn't get angry, so I can get in. Hi, is everything okay? So I'm just waiting for the moment.
Okay, so that's important to know as well. So you were judging the situation, weren't you, on the sidelines? And
exactly.
Did you feel, so if we were to, so you were grading the severity of the conflict, weren't you?
Yeah.
If you were to grade this mild, moderate, severe, what would you?
So I would put it between mild and moderate, not more than that. Somewhere between, mild and moderate, yeah.
And I think so Arisha's comment, actually, probably she wasn't as surprised as she thought she was going to be, and so it's
done so well. Yeah,
yeah. I expected like at least a table flip, like someone needed to throw something.
Well, that may be the difficulties of Zoom, but for the next panelists, we'll ask them to do that. But Hashim, what did Harish do well, you think, that failed?
Yeah, I think she managed to address all the patients' issues from the beginning. And what I admired at the end is that she tried to gear the problem into a situation when he can more understand what does he do for living, and he's a builder, and she asked like the stuff he needs to set up to make up the setup ready for building. The same for us as surgeons. So we need to reach a certain stage of arthritis, like a late stage of arthritis, then we consider surgery, because surgery is the last resort. And like if we do a hip replacement, it's going to last for so many years and it's going to need a revision ultimately. So that's the reason we're trying to delay this. So yeah, I found this really helpful. I learned today from this, to be honest.
Yeah,
it's a nice way of saying it. Yeah.
Yeah, so thank you for highlighting that, Hashim. That reflection there is that, so Harish, you put yourself in Mr. Smith's shoes.
Yeah.
Yes.
Maybe a bit too big for you, but you were.
Well, it's done so well. Yeah.
Thank you.
So so put yourself. So that's probably the one thing we should take away from that one. This is a common scenario. It's only going to get worse. Do you know how many people are waiting on the orthopedic waiting list as of
90,
today?
7 million.
92,000.
All of England. 90,000. Yeah.
Yeah, for a hip or a knee. So we are seeing. If you talk to your colleagues in whatever specialty, it's just becoming increasingly frustrating for the patients. They don't care about COVID. They see the sun shining. They feel their hip or their knee hurting. They want their operation. I think we're in a more fortunate situation that our specialty, that it's not such a life-threatening problem, and that's why there's such a long waiting list. We have to prioritize accordingly. But that's certainly well handled, Sarish, and thank you, Albert Smith, for playing the part. We'll now, so remember that, put yourself in the shoes of the other person. So
thank you.
We'll move to the next scenario.
Thank you. Just before we do that, if we wouldn't mind just doing a quick poll. If I'm just going to launch the poll, so it's a simple question. Is this something you've experienced? We'll give you about 30, 40 seconds. So the overwhelming majority of you have, the 6 people that haven't, probably maybe medical students, I don't know, but 91% of you have experienced something like that. So you can see how useful this the session would be to help with that. Fine. So what we'll do is we'll now just go on to, let me just stop share results, and I'll go on to the next scenario.